Welcome back, everyone. I'm Harold, and today we're continuing our journey into the HIPAA Privacy Rule. Last time we covered what PHI is and who needs to protect it. Today we'll discuss how PHI can be used or shared in clinical research, when authorization is required and when it isn't. Let's get started. In clinical research, we often need to use PHI to conduct our studies effectively. But HIPAA sets specific rules on how we can use or disclose this information. Generally, there are three main ways we can access PHI for research: with individual authorization, through a waiver of authorization, or if the data is de-identified. First up, obtaining individual authorization. This is the most straightforward way. Before using someone's PHI, you get their written permission. This authorization must be specific about what information will be used, who will use it, and for what purpose. This is about transparency and giving control to the participant. Now, there are situations where we might not need individual authorization. One example is when an institutional review board, IRB, or privacy board grants a waiver of authorization. This can happen when the research poses minimal risk to privacy and it's impractical to obtain consent. Another case is for preparatory research activities, like designing a study or assessing feasibility. Here you can review PHI without authorization, but you can't remove it from the covered entity. Lastly, if the data is de-identified, meaning all identifying information has been removed, it's no longer considered PHI under HIPAA. De-identified data can be used freely for research purposes. Speaking of de-identified data, it's important to know how to properly de-identify PHI. HIPAA outlines two methods, the safe harbor method and the expert determination method. In the safe harbor method, you remove 18 types of identifiers such as names, geographic data smaller than a state, all elements of dates, except year, and so on. The expert determination method involves having a qualified expert determine that the risk of re-identifying individuals is very small. Whichever method you use, the goal is to ensure individuals can't be identified from the data. Another key concept is the minimum necessary standard. This means that when you use or disclose PHI, you should limit it to the minimum amount necessary to achieve your research purpose. Be mindful and do not access more information than you really need. So, what does this mean for you as a researcher? Here are some practical tips. Always consider if you need identifiable information or if de-identified data will suffice. Obtain proper authorizations when required, and ensure they meet HIPAA's specifications. If seeking an IRB waiver, provide all necessary documentation to demonstrate minimal risk. Apply the minimum necessary standard in all cases. Stay updated on your institution's policies and procedures regarding PHI. By following these practices, you help protect participants' privacy and maintain the integrity of your research. Great job making it through this section. We've explored the rules for disclosing information, de-identifying data, and the minimum necessary standard under the Privacy Rule, a key principle for limiting PHI use in research. Next, we'll move on to the Security Rule, which establishes the safeguards needed to protect PHI from unauthorized access and security threats. See you in the next session.